everyone, and thank you so much for inviting me to do this. My name is Richa Rehan. I own a Pelvic Health Physiotherapy clinic in Ottawa. We work a lot with women's health, incontinence, pelvic pain, pregnancy, post-pregnancy issues. And we do talk a lot about normal, not normal things. So I'm glad we're talking about this today. And if you have any questions, you can feel free to ask me at the end. So the very first thing is I'm going to, there are always few things like what we talk about, like how exactly, few things which we all should know about our pelvic health, or we should know about our health, because a lot of times I get this questions like, okay, what is pelvic health or what is pelvic floor? We all have kind of different definitions of it and what's related to pelvic floor and what's not. So we are going to start with the anatomy of pelvic floor. That's something we all should know about our body and how exactly it works. So I have a pelvic model up here. So this is how pelvis is. That's our hip bones. So that's the hip bones. That's the lower back. That's the tailbone right there. If we look at the front, there are the pubic bones right here. And at the bottom, this is whole pelvic floor is. So if we see, it's going all the way from the pubic bones to right at the back on the tailbone, and then on the sides, it's attaching to the sitting bones. So it's kind of closing up that whole bottom, like the bottom of the canister. This is the muscles which are holding everything in. Now, if we see inside how the organs are placed there's a bladder at the front, there's the uterus and the fallopian tubes, and then there's a rectum at the end. So what that means is these are the muscles which are holding all these organs in there. So that's supporting these organs, which is one of the major function of these muscles. But other than holding these organs, these muscles, as it ends right here, and the abdominal starts right here. And if we see at the lower back, it ends right here, and then all the lower back muscles starts here. So these muscles, in coordination with these abdominals and lower back, it supports our core. So we always talk about strengthening our core, making our core stronger. What exactly the core is, it's not just our abdominals or it's not just our lower back. It's the combination of these abdominals, lower back muscles, and the pelvic floor. They work along with each other. Now, how this functions is, so let's first discuss about the major functions of the pelvic floor. So definitely it's supporting all these organs. It's working with our abdominals and lower back to support our core. It's keeping our pee and poop off from the floor because it works as the sphincter, so it closes. And these are the muscles which relaxes and let the intercourse happen or any sexual activity happen. Because if these muscles are too tight, if it's not going to relax, it will be harder, like there's more chances of pain with the intercourse. So now along with these muscles, there's a diaphragm which works in combination with these muscles. So how the whole breathing functioning works is there's the diaphragm on the top, abdominals up here, lower back muscles, and pelvic floor at the bottom. So every time when we breathe in, our diaphragm moves down, our abdominals, our belly comes out, and pelvic floor drops down. So this whole thing moves like a piston. When we breathe in, it moves down. So technically, our pelvic floor relaxes when we breathe in. And when we breathe out, it moves up. So it moves like a piston, but a lot of times, either because of the pain during the pregnancy, a lot of times we mess up this breathing pattern and we start doing opposite, that we feel more relaxed when we are breathing out, and we are breathing out, let our belly comes out. So it's every time, it's like whenever we start doing the exercises or if we are just doing the breath work, that's kind of a key to it, that every time when we breathe in, our belly comes out, our pelvic floor relaxes. When we breathe out, pelvic floor squeezes, belly goes in, and the air comes out. So that comes the whole functioning. And let me just open the next slide. So that comes the what is exactly pelvic floor and what's the functions of pelvic floor. The next thing is, how do you know if your pelvic floor is functioning properly or not, or do you have any pelvic floor issues? The one and most important thing is incontinence. So, incontinence is very, very common. It's not normal. Any bladder leakage with coughing, sneezing, jumping, running, if you avoid going out on trampoline because you know you might leak, if you cross your legs when you're sneezing, so these are the signs there might be a possibility there's a pelvic floor dysfunction, that's the reason we want to cross our legs when we are sneezing, or we avoid jumping, or we will do our whole workout but we will not do the jumping jacks. It's like, oh, I might pee if I do the jumping jacks. So these are all the signs which we know that if there is any of these, it's common, it's not normal, and pelvic floor physio can help with this. The other thing is any pelvic pain, any pain with intercourse, any pain in the pelvic area. It is very, very common. It's not normal. Sometimes, even in the younger age, people do have pelvic floor dysfunction, which causes the pelvic pain. Sometimes, after giving birth, either because of C section or because of the perineal tear or any like forceps delivery, any of these things may cause more tension in the pelvic floor, which leads to the pelvic pain. Any chronic lower back pain. Sometimes we try everything to get that back pain better, but nothing is working out. But as we see how these lower back muscles are so close to the pelvic floor, so if there are any pelvic floor issues, that might be the reason that the back pain is not getting better. Any urgency, if you have to rush towards the washroom and you know you can't hold the urine, there might be a pelvic floor dysfunction, because the way the capacity of bladder is, we get enough signals before it reaches like, okay, I have to be in the washroom right now. So any urgency or any waking up at night to go to the washroom is not normal. But same, like it's very, very common, like 1 out of every 3 women or 1 out of every 4 women do have these issues. So this is kind of a questionnaire where we can check like, okay, I might have it and I don't have it. Now, what are the types of like, so even like incontinence, it have like different, so there's the stress incontinence where it's like, there's like if we jump, if we sneeze, laugh, like any of these, and there might be like either might be a like just few drops of leakage, or there might be like just no control on the bladder and a lot of leakage. So no matter it's a few drops or is it a lot, but either way it's still an incontinence. And if it's hard to hold the urine when like you're going towards the washroom, and sometimes there's a leakage like on the way, or sometimes it's like we call it like key in the door syndrome, that as soon as you as soon as you park your car in the driveway, put the key in and there's a leakage like right there. And sometimes because the way whenever our bladder gets full, it gives the signal to our brain that, okay, I need to go to the washroom. And so our brain tells like, yeah, once I'm at home, I can go to the washroom. And it takes the signal that as soon as we put the key in the door, it's like, okay, now I'm home and I can go. And there's a leakage right there. So these are the signs of the urgency that our bladder is not able to hold, and it's just there's a leak with there. And any of these incontinence can be like it recovers so quickly with the pelvic physio, and it gets better in no time. But we will talk about few of the techniques what we can start doing if anybody have any of these issues. And then sometimes there's a mixed incontinence, which is like a combination of both. There's a stress incontinence too, and then there's a urge incontinence too. So, okay, so there are some fun facts, not so fun facts about the pelvic floor issues. So it's like 1 in every 4 women do have pelvic floor dysfunction. And out of that, if we include the childbirth, after childbirth, 1 in every 3 women have it. 1 in every 9 men do have pelvic floor issues, because men think they don't have a pelvic floor, but actually they do, and they don't take care of it because like, oh yeah, no, might be I'm going to the washroom like 15 times in a day, but yeah, it's normal. It's not normal at all. In Canada, 3.3 million Canadians do suffer from the pelvic floor issues. And only 1 out of 12 people do report it, because people just think there's so much stigma around it. It's a shame to talk about pelvic floor or pelvic plane. So people don't talk to their doctors about it, or they don't do anything about it. They just ignore it or just laugh it out. That fine, it's a part of my life now, but which is not good, because it can get better, and it can get better like very quickly. Like, it's not that there's a big long route towards it. No, it gets better in no time. A lot of times the pelvic floor have like, might be, it feels fine until we get into the premenopause and menopause state, and then it starts affecting the pelvic floor. Like, it's like so fine till that. So it's like sometimes like, oh, I never had any issues, it's just I should accept it as a part of menopause or premenopause. And same, like, no matter at what stage of life it comes in, but it can still get better. So, a few of the things, why should we care about pelvic floor, or why should we care about our pelvic health? The one major thing is it puts a very, like, it's socially, it feels like it's such a stigma that people don't want to talk about women's health. They don't want to talk about pelvic health. It puts a lot of pressure. It starts affecting the quality of life. Some people, they might want to go for a hike, and it's like, oh, I can't stay away from the washroom for like 3 hours, it's a very long time. Or might be just going on a long trip, and it's like, oh, will I be able, especially like with the COVID, it's getting worse. It's like the washrooms are closed everywhere. So it's like, oh, I'm going there, but I have to plan my trip. Like, can I find the washroom there? Or it's like, oh, their washrooms are closed, so I'm not going to go there. And it's like, I have a couple of friends where we were like, yeah, we were planning a hike and to the rock dental, and it's like, oh no, the washroom are closed there, I can't go there. So it affects kind of the every part of your life, because everything is just revolving around it. And then a lot of times there's the feeling of embarrassment and shame, like, oh, if I'm gonna go there, I might leak, or I can't go to this party, I have to make sure that there's a washroom right there. And in long run, gradually, sometimes when these problems do get worse, it starts like, it's kind of depressing for a lot of people, because like, might be somebody who's very, very active doing the run or doing the workouts before, but can't do that anymore because of, and that was the part of their life. Or just socially going out, and it's like, oh, I can't go out anymore, because if I'm going for a walk, have to make sure that I go to the washroom before, after. Like, it's a lot of things to think about, and it's like we are just stressing ourselves all the time, just revolving around that thing. And a lot of times, because of the pelvic pain, it's like people are scared to go into a relationship. Was like, oh, I know, like, I have a pelvic pain issue and I'm not doing anything about it. But that's kind of making everything worse, because any pain, it puts our body, like, there is this cycle. Like, if there is a pain, the muscles tighten up more, and the more tightening in the muscles, the pain gets worse. So it just keeps going on and on if we don't do the treatments for this. So there's a big talk about Kegels and not to do the Kegels. And there will be like those chair. I just saw an Instagram post today in the morning. It was like 1,100 Kegels a day. I was like, what? Like, if you go to the gym, will you do 1,100 biceps curls? You won't. Then why will you do 1,100 Kegels in a day? Or it's like, oh, every time I stop on a stop sign, I do my Kegels, or I do 100 Kegels a day. So any of these exercises, if I'm not going to do 100 crunches, I'm not going to do 100 Kegels. Or if I'm not doing 100 biceps curl, I'm not going to do 100 Kegels. Why? Because it's a muscle. So it's like any other muscle. If we are overdoing something, it's going to go into the spasm. It's going to get more tight, which will cause more problems. So as we talked about the breathing, so for example, I will talk about the biceps. If I'm doing a biceps curl, or if I want to build up my biceps, I'm going to bring the weight here, and I'm not going to roam around like this all day. I'm going to do this, and then I'm going to relax it. So why I'm going to keep my core tight, or why I'm going to keep my pelvic floor tight all day? No, it needs to squeeze and it needs to relax. And that's how it works with the breathing. So as we said before, there's a diaphragm on the top, abdominals at the front, and the lower back muscles, and the pelvic floor. So a proper way to do any exercises, or even if we talk about Kegels, when we breathe in, it moves down. When we breathe in, everything moves down. When we breathe out, it moves up. So in that way, we are activating the muscles, but at the same time, we are relaxing once we are done with the squeeze. Because if we keep doing like that squeezes and keeping it tight, the muscle is going to get more tight and more tense. And any muscle, when it's more tensed and more tight, it's going to cause more pelvic pain, lower back pain, pubic pain, all these issues. So we need to squeeze it and we need to relax it. And we shouldn't be going for 1100 Kegels in a day or 100 Kegels a day. Okay, so how the pelvic physiotherapy works. So the pelvic physiotherapy works is it's not always about doing the internal examination, or it's not always, it depends on somebody, if somebody feels comfortable with internal examination or not. The pelvic floor assessment, or the pelvic floor assessment done by a physio, we do assess lower back, we assess the posture, we assess how your abdominals are working. And if you're comfortable with, then we do the internal examination. But it more depends on how all these muscles are working in coordination with each other, because we are so used to keeping that core tight, keeping those abdominals tight, keep it suck in all the time. But no, we are not going to keep any of the muscles like that. We are not going to keep any muscles tight. So when pelvic floor examination is done, it's not like the medical examination. There is no stirrups involved. It's more of like a digital, like the two-finger examination, to check if these muscles do have a good strength or not, if it's squeezing well and it's relaxing well. Is it activating with the breathing or not? Because a lot of times it happens, it's not the issue coming from the pelvic floor. It might be the lower back muscles which are more weak. It might be the abdominals which are not holding the tension well, or it might be the glutes which are not working properly to support all these functions. And unless and until we are not doing this full body examination, we will not know that if your pelvic floor is strong or is pelvic floor relaxing well. So it's the combination of all these. So when you go for an initial assessment, this full assessment is done. And after doing this, the physio give you some exercises or talk about the treatment which is done. Talking about the pelvic organ prolapse. So prolapse is a very, very common thing, which is a lot of women feel it. Exactly what is prolapse? As we talked about these organs, which are inside up here, and most of the time it happens after childbirth, that because of the tear or because of the way we are holding that pressure, these muscles do get very, very weak. And either the bladder or uterus or the rectum, it's dropping down as compared to where it was. And it gives that kind of a heaviness and pressure kind of feeling in the pelvic area. And whenever we like, so, and especially like with running, jumping, or sometimes at the end of the day when you're on your feet for too long, at the end of the day this feeling starts coming in that okay, pressure gets worse in the evening because just the gravity is pulling everything down. So if it's the initial grade of prolapse, it gets way better with the pelvic physiotherapy because we start working on these muscles, having these muscles more stronger and maintaining that abdominal pressure well. It's just not pushing everything down and not causing that pressure kind of feeling. So that's about the pelvic organ prolapse. Talking about the pelvic pain. So pelvic pain, there are a lot of different kinds. There's the dyspareunia, which is like the pain during the intercourse. Most of the people do suffer from the pain with intercourse, either if somebody have a condition like endometriosis, a lot of pressure, a lot of tension on the pelvic floor muscles, and those pelvic floor muscles are tight all the time. So during the intercourse, if those pelvic floor muscles are not relaxing and it's creating a lot of pressure on there, then it causes the pain with intercourse. Abdominal cramps during the period. So having the period, like discomfort during the periods is okay, but any severe pain during the periods is not normal at all. is just there's a lot of tension on the pelvic floor, the abdominals getting all cramping up, and that makes the like all this period pain worse. And there are really good techniques and the ways to relieve that period pain. The pain around the tailbone. A lot of times we feel like, okay, I'm having this back pain, but there's like no actual tender spots on the lower back, but it's still the lower back hurts all the time. Sometimes it's more of because either the injury on the tailbone or the way we sit. So if it's too much pressure, constant pressure on the tailbone, because all the muscles just kind of attaching on there, that causes a lot of pressure up there and makes the tailbone pain worse, which presents more like a lower back pain. So for these kind of pain, what we can do is the first thing is the relaxation, the breathing technique, what we talked about, that when we're breathing in, that pelvic floor needs to relax. It needs to just get the way out and kind of get more relaxed. And that helps with this. But at the same time, the posture plays a big role in this pelvic floor muscles. So if we are sitting with a slouch posture, all of our pressure comes right on that tailbone. So right now, if you will try sitting with the slouch posture, you can feel all the weight is more of up here. Whereas like when you're sitting up straight, you can feel that the pressure is more on both those sitting bones. And as soon as the pressure is more on the sitting bone, it lets the pelvic floor relax because it's not putting the direct pressure on that. But once we are sitting with the slouch posture, more of the pressure is coming right on that area, which makes the pelvic dysfunction worse, because if it's a tight pelvic floor, it's a more pressure on that with our posture. And a lot of times there are big complaints about the pelvic pain about the after the vaginal delivery. So during the childbirth, if there is a perineal tear or if there is an episiotomy, it comes like right in that perineal area. So that's the area right between the vagina and the anus. And if there's a incision around there, so most of the time it's never taught in the like after the childbirth that we need to. So it's like the scar tissue massage. So any incision, no matter if it's on the perineum or if it's a C-section scar, it's just there's more of tension. So if we have any other surgery, we will mobilize that scar. We will move it. But we are not doing it with the perineal scar or the C-section scar. We are just leaving it alone. We are not touching it. And it's like, okay, I don't want to look at it. I don't want to have anything to do with it. But unless and until we will not mobilize it, it's not going to be doing the full function, which is the squeezing and the relax, and cause more pain, like pain with intercourse, pain with putting the tampons in. And it's like anything, it's just like a lot of tension, and gradually over the years, it makes it worse. Yes. And as we talked about the normal and common things, like there should be no pain with intercourse. Like it should, no matter after doing the childbirth, no matter it's the first time or no matter it's on the regular basis, it's not normal to have the pain with the intercourse. So the next we are going to talk about some bladder habits. The one thing is only go to the washroom to pee when you have a strong urge to pee. Don't go just in case. So we call it just in case peeing. So it's like if I'm going for half an hour walk, it's like, okay, might as well, I should empty my bladder if I'm going for half an hour. Or might be just going from one room to other room, it's like saw the washroom right there. It's like, okay, might as well go and empty my bladder. So any just in case peeing, if you are going out for a few hours, going to bed before night, that is okay. But any just in case peeing other than that is not good for bladder. Because what happens is, so if we talk about, okay. So in the bladder, when it starts filling in, it gives our brain a signal that it started filling it in. The second signal we get a little bit up higher where it's like, okay, I should go to the washroom. It feels like my bladder is full. And then we start getting the third signals like, okay, I need to go to the washroom right now. My bladder is full. But if we start emptying our bladder more frequently, then it's never going full right up to there. And our brain learns that that's the actual capacity of the bladder. Like it doesn't get full up to here. And brain starts giving those signal more earlier that, okay, my bladder is full, I need to go, which increases the frequency of going to the washroom. The next one is, yes, no power peeing. So it's not that if we are in rush, we go to the washroom and we just try to like push and just empty our bladder as soon as possible and just get back to the work. So when you go for peeing, you need to just go, sit, let your muscles relax, and let the pee come out by itself, like not pushing it to come out as soon as possible. Uh, the other major problem comes in with the pelvic floor dysfunction is a lot of times when we are not going to the mall anymore, but before, when it was okay, going to the Costco or mall, and we don't want to sit on the toilet seat and be more of hoover on the toilet seat, because if we do that, it's not letting the pelvic floor relax, it's keeping the pelvic floor more tense. And if we constantly keep doing it over time, it's causing more tension on the pelvic floor, and it's not good for the bladder health. uh, Trying to do the Kegels while peeing. So it's like, don't hold your pee, and it's like, okay, it's okay to find out the muscle that, okay, let me check if it's working or not. But it's never a good idea to do the Kegels while peeing, that, okay, constantly I'm trying to hold it. Because it confuses the brain, because brain tells like, okay, it's okay to pee, the pelvic floor can relax, the bladder can squeeze, and the pee can come out. But then we start squeezing these pelvic floor muscles to stop the flow of urine, and brain's like, okay, what's going on? I'm supposed to relax these muscles, and it's not relaxing. And don't ignore the urge to go to pee. If it's been too long, you know your bladder is full, don't keep ignoring those signals. If it's been like past 4 hours and you feel like, oh, I should go to the washroom, it will be a good idea to go to the washroom. The next, we talk about the bladder irritants. So caffeine, alcohol, any carbonated beverages, spicy food, artificial sweeteners, vinegar, and nicotine. These all are bladder irritants. So when it irritates the bladder, sometimes we have more frequency, we end up going to the washroom more often. So it's our habit. Sometimes we think like, okay, I'm not going to drink a lot of water because it just make me go pee more often. But it's not that. It's more of these bladder irritants, which increases the frequency and it irritates the bladder. So if we talk about like, okay, I'm not going to drink a lot of water because it make me pee more often. It kind of do opposite, because if we are drinking less water, it irritates the urine is more acidic, and it will irritate the lining of the bladder more. And if it's more irritable, it will make us go more often, or it will cause more bladder leakage. So it would be a good idea to drink enough water so that we are not kind of dehydrating ourselves because we need to go to the washroom more often. And now we're going to talk about the healthy bowel habits. So I'm not sure if anybody have heard about the squatty potty or not. Squatty potties are great because that's the ideal position to sit on the toilet, that our knees are supposed to be higher than our hip and our feet should be supported. So if you want to ever try that the squatty potty works for you or not, it's more of, because if we are not using the squatty potty and our knees are lower than our hip, then the anorectal angle, which is the angle from where the poop comes in, it's kind of more kind of kinked all the way like that. But as soon as we have our feet up and our knees higher than the hip, that angle is more of like that. So it's easier for poop to come out. Why should we care about the constipation? Because chronic constipation, as we see, the rectum is sitting right on those muscles. If we have a chronic constipation, if it's that pressure on the pelvic floor all the time, and if it's the harder poop, it needs more pressure to come out. It's putting more pressure, it's more tension on that pelvic floor to relax and let the poop come out. Over time, it will cause more pelvic floor dysfunction because the muscles are working harder to let that poop come out because it's just so hard. And it's like, if you want to make sure that you're having the right consistency of poop or not, the best idea is to go with the Bristol stool chart to see what's the consistency of it. And definitely eating a high fiber diet will be very, very helpful. And yes, so I will talk about few of the techniques, what we can do when there's a strong urgency, or if you feel that, okay, I keep going way too often. And so it's like anytime in between 6 to 8 times in a day is okay to go. But if somebody's having like 10 to 15 times in a day, that's not good. On any waking up at night to go to the washroom is not good. But yeah, if your bladder is definitely waking you up, you have to go. But that tells you that you might have a pelvic floor dysfunction. So whenever you have that strong urge to go and you felt like, okay, I just went like half an hour ago, if you will do these breathing exercises, that when you take a deep breath in, let your belly come out and let your pelvic floor relax it. So taking a deep breath in and relax pelvic floor, and take a deep breath out and squeeze your pelvic floor. When you will do it few times, you will feel that urge is a little bit reduced. Then just distracting yourself, start doing something else. And then it might give you a few more minutes, or might be 15 minutes. You will forget about it. And then you can see if you really need to go at that point. So what it does, it is just distracting yourself from going peeing right away. And that will give you a little bit more time, because if you will keep, as we talked, if you keep going more often, it will make your bladder think that, okay, that's the actual capacity. So if we rate it on like 0 to 3, 0 is you don't want to pee at all. And 3 is like, okay, I have to be in the washroom right now. It's always a good idea to think about it and click, wait till like it's 2 to 2.5, like where's like a 2 to 2.5 is like, okay, I should go now. But it's not like, oh, I think my bladder is full, but not really, and I should just go, because that becomes a habit gradually. So that's kind of the best way to kind of stop that. If you had like the C-section or a vaginal delivery, no matter it's recent or it was a years ago, if you never worked on that C-section scar, if there's any hypersensitivity up there, or if there's any pelvic pain, it will be a good idea to just have a look at that scar and incision and see how it's moving. Kind of check the mobility on it. And same with the perineal scar, like check the mobility on it and see if it's very, very sensitive. You can just kind of rub around it, release it, and kind of massage that area. And that will reduce the sensitivity on it. And it will also more become a part of like when you're doing that breathe in, because if you're not doing any mobility on that, or not any massage on that, that part might be like when you're doing the deep breathe in, it should never be like, it should be more right on that abdominal, right on that lower abdominal, coming out and in all the way. Same things with any workout. If you're doing any abdominal crunches, if you're doing any core workout, if you're doing any planks, side planks, no matter which core workout you're doing, always make sure you're not like, in a lot of workouts they say make sure you keep your belly tucked in. So don't keep it tucked in all the time. Do a full deep breathe in and out. So if you're in a plank position, make sure like even if you're doing it for 30 seconds, you do that full deep breathe in and out rather than keeping that belly tucked in. If you're doing abdominal crunches, make sure you do a full deep breathe in and breathe out while coming out. So these are the few techniques which you can start doing. Like if you're doing a workout, if you're working on that lower abdominals, if you're working on pelvic floor. So these are the techniques which will kind of save you from kind of putting more tension and more pressure on that pelvic floor area. And I will also leave my Instagram handle and my Facebook page, because I do post a lot of education session and the value and the exercises to like which you can quickly do and kind of more connect with your pelvic floor. See if your muscles are working in like with a good flexibility and good strength. A lot of things like what's normal, what's common, which shouldn't be there. So yes, I know it's a lot of information, but I can definitely take any questions if there are.